talking, come on down the line. You give me some good advice, I'll give you some time to help me be a healthy person.
Welcome to Health Chat. We're out here at Capitol High School at KCS TV, and my guest is Pat White, CEO?
Yeah.
Are you CEO?
Executive Director.
She's
yeah.
Executive Director of the Health Right program here in Charleston. And we want to hear about Health Right, Pat. What it's doing, where it's going, what you're thinking.
Okay.
What is it?
Well, it is a free clinic. We provide services to the uninsured poor. 83% of our patients actually are connected to the workforce. So a lot of people think,
That's a myth, isn't it?
Yeah, a lot of people think, well, it's just the homeless population, but and others, and we do serve that population. But we also serve the working poor. That's primarily who we serve, and we provide a full range of services to them. And by that I mean medical services. We have every specialty covered at Health Right through the generous volunteerism of the doctors and the dentists and the pharmacists and others that routinely come in and give of themselves to help folks.
Who do you employ?
I have a staff of, let me think, around 35, 36
Are they
people.
providers?
They're primarily providers. Well, it's because we're medical and dental. So I've got dental hygienists, I've got nurse practitioners, 5 nurse practitioners, well, 4 and a quarter, something like that. And then we have farm techs, certified medical assistants, registered nurses, so it's dental assistants, so it's a smorgasbord of healthcare delivery people.
So I work at Walmart and I'm making $9 an hour and I've got a fever and I'm throwing up.
Yeah.
And I'm really afraid of going to the emergency room or any place where I'm going to get a bill for $600 or $1,600.
Right.
And I go to your place, what happens?
Right. Well, we do an intake to make sure that the person qualifies for the services. We're a real good steward of our funding. And then they're scheduled in for an appointment. We do next day appointments primarily. So we've got, it's pretty good access where you call in one day and then you come into the clinic the next day. And that's for primary care. And then specialty care, we have not only our patients, but we do a referral from other sites like Cabin Creek and Family Care that send patients to us that need specialty services but that can't afford to see a cardiologist. The volunteers are absolutely wonderful. I mean, it's not only what they do on site, but they do things off-site. Charleston Area Medical Center, Thomas Health Systems are big supporters of Health Right because we keep patients out of their ER for them who are uninsured. Right. And they provide inpatient care to us free of charge to Health Right patients. The doctors that volunteer, even some of the retired ones. This year our Volunteer of the Year is Dr. David Santrock, who's a retired orthopedic surgeon. And he comes in and does orthopedic work, and then he gets his buddies to see patients that may need a hip or a knee replacement. And all of that is covered as part of what we do. So it's a really good system from entry from a common cold into, congestive heart failure to hepatitis C and treatment.
Do you have a sense of how much health care dollar-wise you deliver in a year?
Yeah, last year it was in the neighborhood of $48.5 million. Our budget is $2.5 million.
And so you're delivering it at that ratio?
Yeah. So it's for every dollar that we get in.
Like
it's $22 worth of health care.
Yeah. Remarkable.
Isn't that yeah. And it's because of the volunteers, and that doesn't cover the inpatient stuff. That's, what we're doing on site or by referral to a private doctor's office that may see a patient, particularly a specialist or oral surgeon that may see a patient in their private practice. And and they are also Health Right volunteers. They may not physically come into the clinic, but they take our patients, and they're just scheduled in like
So, and they do the
any
pro
other
bono.
patient. That's right. And then if they need something, let's say the doctor sees them in their private practice, and they need surgery, then we do all the pre-admission testing through Health Right. We get all that done. Everything's worked up, and then it's...
What are your models for this? Is there a model for it?
Well, we're
in
not
this
the
country?
only free clinic.
No,
We've
no, of
sort
course
of developed it over time. There's around 1,600 free clinics nationally.
Which ones stand out in your mind as, you know, if you
There's
could,
the Greater Cleveland Free Clinic, Kansas City Free Clinic.
these are terrific clinics.
Really big clinics,
Yeah.
robust clinics that are similar to Health Right, serving lots of patients in a very comprehensive manner.
Right.
In West Virginia, we have basically 9 free clinics that are scattered around the state, mostly in more populated area, Morgantown,
is
Wheeling.
Health Right a branded name like
No.
Covenant House?
No.
You're the only Health Right.
No, there's other Wheeling Health Right. It's not a branded name, but other people picked it up, and
I see.
we were the first, and I would say we had the audacity to name ourselves West Virginia Health Right, like there would be no others. There's Beckley Health Right.
Oh, there is. So
there's
but it's not a branded
It's
thing.
not a branded thing, but they are all free clinics.
Yes, okay.
And so we're doing a lot of stuff there. Our health education programs, as you know, are
Tell
an
us
integral
about that.
part.
I think that's very interesting.
Yeah, we started doing health education programs years ago, but we've really, with the assistance of the AstraZeneca Healthcare Foundation, have been able to grow those programs unbelievably. So we have tobacco cessation, we've got diabetes. We had a small grant from the American Pharmacist Association, and it was one of these things where I was, we'll do this. Yeah, it's $25,000. It'll help our diabetic program. And then they had this, test that they wanted us to give to the patients, and I thought, oh God, another piece of paper, And in fact, we now give it to every diabetic who comes into the clinic because it's a good mechanism to determine where they are, how much knowledge they have about their disease and what they can do about it. Eating, exercise, medications, whatever. And that's been a really good tool. We developed from that, we developed a diabetes for beginners. Diabetes 101.
Well, you have incentives. I mean, people don't always want to take care of their health, but I'm
We
sure
do, yeah. I mean, the AstraZeneca Healthcare Foundation's enabled us to do gas cards. We do community support. We, give away dinners and have drawings, and so if they come to a class, they get a gas card. We get sometimes they get a food card. When we did our Linda Horn Raw Fusion program, Ninja donated all sorts of blenders to us, which was really nice. And it's we've got WVU extension service that comes in. We've got cooking classes, exercise
so you
classes.
imagine health in a way that
The whole
maybe
body.
if you jump back 30 years ago, you didn't quite imagine it.
Oh yeah, it's very different now because of resources. For one thing, we've been able to. We're more into chronic disease. We have we push the patients. It's a free clinic, but if they're diabetic, we want them to go to diabetic education classes, and we encourage them to do that and push them. They'll get a glucometer. They'll get strips when they go to class. Those are
Is
really
diabetes, you think, the biggest challenge? One of the biggest?
one of the biggest.
One of the
yeah.
big-
Obesity, I think, is
And diabetes. the
and
two.
diabetes. Those
But you
two.
can be obese and be healthy,
Oh yeah.
can't you? I mean,
Yeah,
I
but
mean,
not
my
so
mother
much
carried
so.
extra
yeah.
weight, but was a very healthy woman.
Right.
Physically healthy.
Right. That's right.
But the diabetes is
Yeah.
that's a tough issue, isn't it?
Yeah, it really is. And a lot of people think, well, my grandma was a diabetic. They say had sugar.
Yeah,
My
had
mama
sugar.
had sugar. I'm going to have sugar. And it doesn't work that way. they can turn it around. It's how they eat, they exercise, how they take care of their body. We're working on a program right now that should start shortly that's with the Kanawha-Charleston Health Department that's a pre-diabetes program that is going to be really push more and more under the Affordable Care Act when that's implemented in January. Some of the wellness programs. City of Charleston is already into some of that a little bit, pushing
What's it gonna look like,
employees.
Pat? What's pre-diabetes going to look like?
It's people who are have a blood sugar level that's elevated but not up to diabetic standards yet.
Right.
They may have had gestational diabetes when they were women, may have had that when they're pregnant, and then no more once the baby's born. Well, those are all indicators, high triglycerides, all indicators that you can turn it around.
Right.
But you need to get on it.
Catch it.
Catch it early so
Yeah.
that you don't, because when you think about what happens to people, even, when the diabetes is uncontrolled, when they're not connected to their medication, which is another part of what Health Right does, has a very robust pharmacy program that's actually developed into a statewide program called WVRX, which we can talk about. But anyhow, if it's not under control, they end up, their kidneys go,
Right.
their, feet, blindness, amputation, all sorts of problems that can be offset if it's caught early.
Yeah. So listeners out there, if you think there's any of this in your family, in your own life, pay attention.
Absolutely.
Please pay attention.
Absolutely.
Yeah.
It can make a difference. It'll save your life.
Yeah. And save our state a fortune.
That's right.
Yeah.
That's right. Because there's a lot that can be done, as you know, through exercise and food.
Yeah.
And, you don't have to, you don't have to go off of sweets. You just need to make sure that the sugar that you're getting is artificial rather than fructose or
Yeah.
some of the, somebody came in yesterday. I actually had a donut yesterday.
Oh,
it was
Pat.
like, I know, and I don't normally eat donuts, but it was like,
You gotta do it
I,
sometime.
every now and then you fall off the wagon, and
Yeah. Yeah. We got a couple of minutes left. Where do you want to go? Where do you want to go with Health Right?
Well, I think that the Affordable Care Act is going to be making a lot of changes for Health Right in the future. There's still going to be a need for a sizable population will be eligible for insurance, and whether they sign up or not is an issue. If the young healthies don't sign up, then you've got a whole nother issue about the financial stability of the program. And it's going to cover about half of the state's uninsured. I think if we're lucky, we'll hit a third of the enrollment at the end of the first year. That's what Kaiser and some others have said. Well, so they're targeting 90,000 people. So if we get 30,000,
So our viewers have to understand that if they've got healthy kids in the family, we need them. We
That's
need them
right.
in the pool.
That's right.
The little bit they give can help a lot of other people just by participating.
That's right.
Yeah.
Yeah, it needs that financial stability. And, it's unclear what's going to happen with the medications. And we've got a statewide pharmaceutical program for branded drugs that's given away $111 million
That's a
in
big deal.
medication. Yeah, of branded medication statewide. And most of the newer drugs, I was reading an article over the weekend about a medication. It was over $300,000 for this drug for a blood disease. But if you don't have it, it's a killer. You're going to die from this,
Right.
like hepatitis C, the same thing. Expensive drugs.
Yeah. Great big challenges, Pat.
Absolutely. Opportunities.
Yeah. Well, you're a treasure. You're a treasure to the healthcare industry
Thank you,
and to
Jamie.
Kanawha Valley. And I appreciate you coming to talk with us about Health Right. I hope you'll come back again.
Okay, would love to.
Thank you, Pat.
Uh-huh.
Wellness wagon, come on down the line. You give me some good advice. I'll give you some time to help me be a healthy person in body, soul, and mind. I'll say yes to life.